I am a subspecialist in arrhythmia problems of the heart. So the most common arrhythmia that we see is called atrial fibrillation. And it really depends upon the age group as well. So arrhythmias can happen even from fetus stage. You know, when a baby is in the womb, some kids have arrhythmias. It can be slow arrhythmias or fast arrhythmias. And then teenage, we see completely different set of problems. And young adults, different kinds of arrhythmias are more common. AVNRT, AVRT kind of a thing. And then as people grow older, there are other arrhythmias such as atrial fibrillation, ventricular tachycardias, sudden cardiac arrest seem to be more common in that age group. Normally our heart beats in rhythm. So that means that the upper and lower chambers of the heart, the atria and the ventricles, are actually coordinated. So an arrhythmia means an irregular or abnormal rhythm of the heart. Atrial fibrillation means a completely chaotic, irregular rhythm in the atrial chambers of the heart. There are multiple circuits in the atrium, and even that would be really simplistic because there's a lot of things that we don't understand about atrial fibrillation. What is the source of atrial fibrillation, and why does it perpetuate itself, and how do we completely relieve the problem? And these are things that are really not well understood. But some simple things we know are there are extra beats in the atrial chambers. We call them premature atrial complexes. And a lot of patients do have PACs that trigger atrial fibrillation. We know that. And also, once patients go into atrial fibrillation, the longer they remain in atrial fibrillation, it becomes difficult to get them out of atrial fibrillation. And that's a fact that we know as well. The field of atrial fibrillation has actually advanced significantly in the past 20 years. So it's relatively a very young field in the larger spectrum of things. So early on, we used to have only medications to treat the atrial fibrillation. And since about 1996-98, there was a description of a procedure called ablation. Remember I said that the PACs trigger atrial fibrillation. So the first procedure was performed where we took catheters inside the heart in the atrial chamber and identified the source of the premature atrial complex and ablated it. Thereafter, the ablation procedure has gone lots of advances. Whether it be the method of ablation, in identification of the structures, mapping of the heart, and even the type of ablation. Now we do ablation remotely, sitting outside the room, patients on the table. Using a magnetic method, we can actually move the catheters and ablate them. The effectiveness depends upon what do you call effective? A complete elimination of this atrial fibrillation is not possible. And the reason it's not possible, it's because it is not one spot or it's not one circuit that is the problem. The atrial fibrillation in general is a spectrum of illness, meaning like it can be, patients can go in and out of the arrhythmia, and for a few seconds, few minutes, few hours, sometimes few weeks, and then sometimes few months, and then sometimes few years. The atrium undergoes structural changes, which is somewhat akin to what I tell patients, atherosclerosis. It's a progressive disease. So meaning like as we grow older, there are very common associations of atrial fibrillation. Like age is the most important risk factor. Like less than 65 years of age, less than 1% of the population have atrial fibrillation. Whereas greater than 80 years of age, about 20 to 30% of the population have atrial fibrillation. So since we can't stop ourselves from aging, it's impossible to stop the atrial fibrillation from occurring. So it's not possible to cure the disease, but it's possible to control the disease. And that's what we aim for.